Hey guys, it's Jessie with Omaha Mom Talks, and I have some exciting news. I am partnering with Edwards Auto Group, a local car dealership with locations in Nebraska and Iowa, for a fun partnership called Mom vs. Machine. Every couple of weeks, I'm going to be test driving a new family vehicle and giving it the full mom review. We're taking it out of the showroom and into the hands of me and my family of 4. We're going to be seeing if it can handle car seats, snacks, strollers, backpacks, how easy it is to clean, how much room do we have, and I'll be giving you my honest thoughts. If you have a car that you have been eyeing, let me know. If you have any must-have amenities when looking for a car, share them with me and I'll be sure to give those a closer look. Follow along and see which car can actually keep up with our family chaos. Welcome back to Omaha Mom Talks, the podcast where we chat all things motherhood and mental health. If you are new to listening, thank you so much for joining us. I'm your host, Jessie Gutierrez. I'm a wife, a mom of 2. I have 2 sweet girls who are currently 5 and 7 years old, and I'm a mental health therapist that specializes in maternal mental health. Today, we are diving into a topic that so many parents are navigating, and that is ADHD and kids. So if you've ever wondered, could my child have ADHD? Is this a normal behavior or could it be something else? And how do I support my child? Where do I go? What do I do? What are the best options for us? Then this episode is just for you. Today, to help give us some expertise and some insight, I am joined by Dr. Phil Boucher. He is a board certified pediatrician. He's also a dad of 6, you guys, and he is a parenting educator who is sharing all of his wisdom and expertise here in Nebraska. He offers writings, workshops, along with pediatric care, and he is going to help us feel a little bit more understood and clear if we are navigating with wondering, does my child have ADHD? So let's get into it. Dr. Boucher, welcome to Omaha Mom Talks.
Thank you. It's so nice to get to chat with you all.
Yeah, I'm super excited to have you join us. All the moms I know listen to you and follow for your expert advice. So a lot of people are excited to hear from you and learn from you. So thank you.
You are so welcome. I'm excited to be here, and I appreciate what you're doing, helping to educate parents to, do the best they can when it comes to their kids.
Thank you. Well, for those that don't know you, please introduce yourselves to our listeners.
So my name is Phil Boucher. I'm a pediatrician. I practice in Lincoln. I grew up in Lincoln and then did my residency and medical school and residency up in Omaha. And I've been back in Lincoln now for about 12 years as a pediatrician. And I get to take care of a lot of families. When it comes to specifically what we're talking about today, ADHD and all the other things that come up in the childhood years, we live right outside of town and have 6 kids and 2 dogs and 2 bunnies. So we have a busy household ourselves.
Yeah. Okay. I have to ask, how old are your kids?
So our oldest just turned 16. Like literally today, we're going and getting her car picked up after school. I know. And then our youngest is 4.
Okay. So you are in all the ages and stages.
The ages and stages. That is a good way to describe it for sure.
That's awesome. And then, so tell us a little bit about just your practice, the work that you do, and your offerings. And we'll probably get more into that later as well.
So when I started in my career, I was at the Omaha at the Children's Hospital for residency. And as I left residency and started out in practice, I knew that I wanted to work in private practice to have more control, more ability to affect lives by having more deep relationships with families, and got to do that for 8 years in a private practice group in town. And then 4 years ago, I started my own private practice, and it's made it even easier to get to know families because we have a really small and intentionally small practice where patients text message us for the most part when they have things that come up. We get a lot of pictures of rashes. We get a lot of baby poop pictures, and we like to text message. We're very like, why are you calling on the phone? If it's an emergency, call on the phone. Otherwise, please please just text us. And most parents tend to like that. So we've been able to develop a really cool patient panel and offerings around being able to develop those deep relationships with parents and their children, and help them to feel understood and heard,
Mhm.
and unrushed in our approach when it comes to their child, whatever their complaints might be.
Yeah, I think that's so important. We want to be able to have that established long-term, hopefully, relationship as a mom. I want that with our pediatrician, and so that my kids can have that too. That's
Yeah,
awesome.
absolutely. It's been really nice. When somebody, my nurse says like Leo is sick today, we already know which Leo we're talking about. We don't have to like go reference their medical record number and figure out who it is, because we all know Leo and his sister was in 2 days ago and she was sick. So of course Leo is sick today. It's that kind of patient panel size and closeness that I've really enjoyed getting to develop here in Lincoln over the past few years.
Yeah, that sounds great. Well, we have invited you on today to chat a little bit about this topic of ADHD and kind of giving parents this roadmap to how to get started and navigate this process. If maybe they just have a hankering thought of, does my
Right.
child have ADHD? Where do I go? What do I do? I want to share that, the context of why this topic is important to me is because ADHD runs pretty strong in our family. I have ADHD, so does my husband, and then so does our oldest, who is in second grade. And so navigating the process with her and figuring out what she needed in terms of what provider do we go to? What's the school support? Just understanding how her brain works
Right.
is something that we walked through as a family. And I am a data research evidence-based person. And so like, I like to just dig into all the things. But like, you find so much different information everywhere that you look. And so
Mm,
I really wanted to just do this episode with you to give some guidance and kind of a frame of reference, kind of this guidebook that I wish I would have had when I was going through it, even as a mental health therapist who has ADHD
right.
herself. I
Right.
still questioned myself, my judgment, what we were doing along the way. And so um, I am just really excited to provide this chat for parents and hopefully help them feel a little bit more informed and a little bit more about, okay, I can confidently move forward with this.
Absolutely. I think that is huge for families because it can be really confusing and there's so much information out there and it's tough to sort through what you should think about, what you should focus on, where to start. It can be really confusing in the social media world. There's lots of positives that it brings in the ways that we're able to learn and connect, but it also makes it really confusing in a lot of ways.
Yeah, absolutely. So, let's just first start with the most basic. How do you define what is ADHD?
Oh, yeah, that's a good question and not an easy question, actually,
Yeah.
either to answer. But I think in the big picture, I would say if we have difficulties with attention, focus, emotional regulation, or task organization, planning, and executing that interfere with our life.
Yeah.
So if it interferes with our day-to-day life at home and or in our learning environment, then that would be kind of my big picture umbrella
Mhm.
diagnosis
Mhm.
scheme, is that it has to be to some degree interfering with
Yeah.
regular life and being able to do things without a lot of challenges, with a lot of meltdowns, without a lot of difficulty at home between child and parent, or at school between child and teacher or classmates.
Yeah. And in as a mental health clinician, anytime we're assessing for a mental health diagnosis, major depressive disorder, anxiety, I work with adults,
Hmm.
not children, but we are always looking at that. Yeah. How is this impacting daily functioning? So at looking at ADHD, maybe a child is a little hyper or a little they daze off and
Right.
daydream, but is it impacting
Hmm.
their quality of life, their ability to do what they're expected to do on a day-to-day basis? I think a lot of folks still have that, and we're learning more to expand our view of ADHD, but we still hear from a lot of folks about that traditional, like hyperactive boy
Sure.
when they think of ADHD. And so, what are some ways that you might see ADHD show up that is not that traditional sense, and especially in girls?
Yeah, for sure. No, I think everybody has like the prototypical ADHD in their head, or when you say my child has ADHD, or I wonder if that kid has ADHD, we
Yeah.
all know instinctively what you're talking about because it's the
Yeah.
external manifestations of they're all over the place, they're knocking things down, they can't sit still, they're fidgeting, they're up and about, they're blurting, those sorts of things are common and easy to recognize. A lot of ADHD, though, is inattentive ADHD.
Mm,
And without close watching, those kids just fly under the radar.
yeah.
They
They fall.
are not the space cadets that are just like constantly, looking around and totally off topic, but they require frequent reconnections to say, hey, here's what we're doing now. But if we are not watching for that, or if there's other distractions, like say we're in the classroom and there are a lot of children that need a lot of hands-on, then the inattentive ADHD child can often go missed for months or years because they're
Mhm.
not causing a stir. And so then they don't, rise to attention of there's an actual issue here. And I think that's what we see most commonly in girls too, is that they're able to hold things together in a
Yeah.
way that the hyperactive boys draw attention to themselves. And so it
Mhm.
takes a lot longer often because they've held it together and they've focused extra hard and they've made up for it because they're smart, and they don't get that diagnosis early when it has been interfering in ways that we just didn't see, in the way
Mm,
that they are thinking about themselves and their self-confidence, in the way
yeah.
that they are learning and their interests and their knowledge and their passions and those sorts of things that are actually being interfered with compared to their neurotypical peers.
Mhm. Mhm. One of the things that I hear from a lot of, especially on social media and traditional media, is that ADHD is becoming more common, and some would say overdiagnosed.
Mm.
Others would say maybe we're just getting better at recognizing it. What's your take on that?
Ooh, I think it's probably both and rather than one or the other. I think in some cases, especially in the past couple of decades, that there has been an overdiagnosis or quick to label children as ADHD, quick to medicate them. And in part, it's because of the increasing demands of school. Like we have to have this child sit still and listen and learn because of the different reasons that they need to do that. And so that's part of the overdiagnosis. But I also think we're getting better at identifying it and putting together those puzzle pieces of, oh, this child has always really melted down easily. They've been extremely sensitive to feedback and they're really struggling with reading. And maybe it's not that they're all these separate things. Maybe the overlying diagnosis is that they have difficulties with ADHD or inattention or dopamine issues that are causing a lot of those symptoms that we're seeing manifest. And so in that way, there's more diagnoses that are appropriate. So I think it's both. I don't have a specific number to
Yeah.
say, but I think it's reasonable to say that we're both there has been an explosion of diagnoses, and in part it's we're better at identifying it, and in part
Mhm.
it's because more kids are meeting the criteria of interference because the demands have increased upon them.
Yeah. So when a parent is kind of questioning their child and themselves, because I lived this. It's
Hmm.
like I remember untangling, like, what is just normal development? Like, yeah, my 5-year-old is really hyperactive. And I mean, I remember when my daughter was 4 and we were in dance class and all the other girls were in line and she was feet on the wall, hands on the
Hmm.
floor, dancing and doing handstands. And I remember thinking, like, oh gosh, is she going to be ADHD because I am and her dad is? And I don't know. But also just being a silly 4-year-old off task is like completely developmentally appropriate. So
For sure.
how do we kind of where's the line between what's typical kid behavior and something like ADHD?
Ooh, yeah, that's a great question. And I feel like a lot of my answers today so far have been like, well, it kind of depends. But again, it kind of depends.
Yeah.
And so um, when we think about like the tricky ones are like the 4, 5, 6 year olds
Mhm.
that are a little bit off the wall, or, they're kind of bouncing around. And you want to be able to give them that chance to explore their world and bounce into things and move their bodies, and you also don't want them to be so off task and so challenging to manage that they can't enjoy and learn and grow and have those opportunities. So for me, when patients come in and they're in that 4 to 5 to 6 range, and
Mm-hmm.
we're trying to decipher that, like, is this just kind of the typical, or one side of the more typical spectrum of inattention or hyperactivity, we start with, well, have we lined things up for their brain appropriately? Meaning, outside of school, do they have free time to move and explore and not have all these demands placed upon them? Are they
Mm-hmm.
getting good sleep? Are they getting good nutrition when it comes to like a protein rich breakfast and avoiding too many ultra processed foods? There's lots of different things that we'll put in place or make sure that we've addressed
Yeah.
before we say, okay, well, we've lined all those things up, and yet still we're having issues that are leading to interference. That then would be the threshold in my mind. Whereas if they just come in off the street, we haven't seen them before, and they said my kid bounces around and is crazy, in dance class or at school or something along those lines, then let's take a moment and figure out what's going on before saying, okay, yep, this is definitely ADHD. We try and correct for some of those other, not soft sort of side of things, but those important holistic whole child sort of perspectives
Yeah.
that really make a difference in figuring out, okay, they're getting lots of outside time, they're eating lots of protein, they're getting good sleep, and yet still here's what we're seeing. Okay, well, then that makes sense to move forward with that diagnosis and then come up with a plan from there with how we're going to manage that.
Yeah. Yeah. And those are things that I think all children we want to reevaluate, right? Like, how is their sleep? Are they getting physical activity? Freedom to play. But sometimes it does take a minute to pause because we're all just, as a parent, some days it feels like Groundhog Day and the to-do list never ends. And so
Totally.
taking that time to reflect and think about, like, oh, you know what? Like, we have been going to bed later or
Hmm.
getting up earlier and those sort of things. And that might be contributing. So let's plan that before we move forward with maybe a diagnosis.
Well, and I think the other thing too is that there's not an emergency to the diagnosis, and sometimes
Okay.
it feels like somebody said something at dance, and now I can get out of my head, and I have to figure out if
Yeah.
this is the case, or the teacher keeps bringing it up at parent-teacher conferences. Well, let's start the process to look into it, and not say that we have to solve this in one doctor's visit,
Mm-hmm.
or that we have to rush to make the diagnosis or rush to get on
Yeah.
medications, because these are all things that this is brain wiring, and we know that it's not going to change overnight no matter what we do, and
Mm-hmm.
that gives us time to figure out what's going on and trend things out, especially as seasons change, as the time changes, like the literal time changes,
Yeah.
with the daylight savings time and all those sorts of things. We can trend that out and see, yeah, this was a big issue, and then they got over their illness, or we had a lighter season and things improved, and so we are able to trend that out over time rather than rushing to, we have to figure this out and turn things around before the end of the month.
Mm-hmm. Yeah. So, for the parent who wants to get their child evaluated for
Hmm.
ADHD, let's chat through what that evaluation process can look like and what they can expect. One question that I hear a lot from parents is, where do I start? Who
Right.
do I go to? Should it be my pediatrician, a psychiatrist, a psychologist? What do you recommend?
I think the easiest place to get in fastest is your pediatrician, because if you're talking about going to see a psychiatrist, or to go to see a psychologist, you're going to be waiting, at least in our area of the country, 6 to 18 months to get in. And I think that by and large, the 90+% of children that do have ADHD, that diagnosis can be made and managed typically in your pediatrician's office as the place to
Okay.
start, rather than saying we need to go see a psychologist, long wait, or psychiatrist, who are often called in for the more challenging cases, or
Sure.
when we're on multiple medications or things along those lines. And so
Yeah.
I think starting with your pediatrician, I mean, I'm biased obviously as a pediatrician, I think that that's a great place to start. And then pulling in those other resources, whether it's
Okay.
psychology for more advanced diagnostics, whether it's a therapist to work on emotional regulation or executive function or play therapy or whatever it might be, in terms of ways to help the child to process, to understand how their brain works, to put those pieces in place. And then in some cases, a psychiatrist, if we've tried some initial medications or something along those lines, if we're going down that route and haven't found something that's working.
Hmm.
But I think by and large, at least 90 to 95% of the patients that I've seen over my career are able to be managed from the medical side of things straight regular with your pediatrician.
Okay. Okay. So for those that are listening, I just want to share a mom context moment. So when we kind of went through this process with my daughter, we did start with our pediatrician, and unfortunately, it wasn't a very helpful or supportive first step.
Hmm.
Um, and this is such a, just this was my one experience. I'm not generalizing it to all, but I remember bringing it to my pediatrician, and she was in preschool at the time.
Hmm.
And I was really just looking for a starter conversation.
Right.
And I got totally dismissed
Mm.
and was given a very, we don't even look at that until they're in kindergarten and that they're exhibiting symptoms in more than one environment, which she technically was in preschool. But, and the thing that I remember feeling so like walked away so disappointed in is there wasn't any follow up questions because
Mm.
me and my brain, I'm like, how are we ruling out that this isn't a sleep disorder or
Right.
a airway issue
Right.
or any other a learning issue, a developmental issue? There was no questions asked. And so I felt so disappointed and
Mm.
unsupported. And I probably waited then like much longer because I sat in it for longer than I needed to before I made any movement. And so it was in kindergarten. We stuck with that pediatrician for other reasons. But then I didn't have trust to go back to
Oh,
her
of
for
course.
that issue. So we went with a psychiatrist at Boys Town who was lovely and we continue to meet with regularly. But that was just our experience.
Yeah.
um, and so I wanted to share that for those that are listening. If you don't get necessarily the support that you need, you can always ask for another opinion or, talk to another provider, not because you're searching for a diagnosis or trying to make it fit when it doesn't, but kind of trust your instincts there as a parent.
Yes, absolutely. I agree completely. And I think that that is a really good reminder that the mileage might vary based on who you see and what kind of presuppositions they have or biases that they might have. It's frustrating to hear that that was your experience, and I'm sorry that it went that way because it's definitely, hey, my child, has a lot of energy, and I'm not looking for a diagnosis, but I do want to just kind of talk it through because I'm not sure if this is typical. Well, then that should, like you said, bring up those other questions of how is
Yeah.
their sleep, what are you doing for movement and opportunities for them to play, and all the different things that we could talk about, and then coming up with some strategies that even if we're not ready to go down that rabbit hole of making the
Yeah.
diagnosis, at least have some ideas of, well, here's where I would start, or here's what I would do. I would make sure that we're doing this, that, and the other thing,
Hmm.
and then let's reevaluate and talk again. That would be what I would hope that most pediatricians would offer,
Hmm.
as the starting place of, there's more that we can do even if we're not ready to go down that rabbit hole. And
Right.
I think that one of the things that is always frustrating to me on the medical side is this we have to have it in two different spheres. And yes, the DSM criteria, if we're looking at the DSM criteria, says that it has to be in two different spheres that we're having levels of interference. And the DSM is great for research and
Hmm.
for, standardizing the diagnoses if we're looking at research trials or something like that. But when we have a patient sitting in front of us, we know that they don't always follow the rule book to a
Yeah.
T. And
Hmm.
I just had a patient recently that came in. She is like a preteen, and she meets the criteria at home. She doesn't
Okay.
meet the criteria at school because she's super smart and she doesn't cause a stir. And
Yeah.
so
She
it's
has
not
systems in place
interfering with
for
her.
that.
She's half attentive, but that's enough for her because she's really smart. And so she would meet the criteria if she was failing in school or if she was climbing on her desk or those
Yeah.
sorts of things. And I feel like those are a lot of the patients that we kind of talked or touched on earlier too, that go for a long time without meeting that diagnosis because they're smart enough to get by listening with half strength.
Yeah.
But they are really struggling with emotional dysregulation or with executive functioning skills, or with inattention, and they're just not hyperactive. And so then they're labeled as, well, it's not happening in two spheres. She's getting A's and B's. She must be fine, when all these other things are out of whack that we could address, and not necessarily like she needs medication straight away, but let's look
Right.
at the whole ADHD, cookbook and see what
Yeah.
else we can do to help her to thrive.
Yeah, absolutely. Like what could be better for her? And I
Right.
just as a girl mom too, like I know when I was navigating this diagnosis for my daughter, I just kept going back to her self-esteem
Oh,
and
for sure.
how
Huge.
I am going to do whatever I can, right, to make sure that these symptoms of ADHD don't
Hmm.
become internalized as like I'm dumb or I'm not good at this or that's just the way that I am and all these negative messages that can happen if the right supports aren't in place.
Well, I think
That was
that's
my big
so important. And I think that's an under recognized short term and long term consequence of
yeah,
unmanaged ADHD is I'm dumb. I'm never going to get it. I just can't do it. And I
mhm,
have to do other things to try and make up for that. The class clown, the
yeah,
dangerous behaviors. There's things that help me to build up my confidence because it looks cool in front of my peers if I climb on top of that shed and jump off, because that gets them to laugh and give me high fives and
gives
those
them a
sorts of things.
dopamine hit.
But it leads, yeah, oh well, yeah, and a huge dopamine hit too. But those lead to more dangerous behaviors and just more damaging mindsets over
Yeah,
time when we haven't given them the self-confidence that they so deserve.
yeah. A question came up for me when you were talking about when those like younger kids come in and see you and you're kind of trying to untangle what this could be. Um, how like is if a parent is wondering and they're not quite sure, is there an age where maybe the symptoms become more clear?
Mm.
Does that make sense?
Usually yeah, that makes perfect sense. I think usually if we're kind of like, oh, let's try these things at home and just kind of touch base, in another few months and see where we're at with things. I think most kids will become much more clear by first or second grade. And
Okay.
usually what we'll see is either they are just blatantly ADHD, and usually it's hyperactive when they're on the younger side that we notice that, and we say, oh
Mhm.
yep, this is what's going on. If they're mixed, both hyperactive and inattentive, or part one and part the other, then they'll usually become more clear as demands in school start to increase. So
Mhm.
second and third grade, I find, is a big time where those demands start to increase in terms of reading and all the other things that are required of us. The
Yeah.
the strictly inattentive ones often present a little bit later, especially if they're very bright and can make up for the fact that they're only listening at 50% speed and have to be reminded to finish their homework and those sorts of things.
Yeah, that makes sense. For the parents that are going to pursue kind of the evaluation and assessment process, realistically, like how long does this process take and what can they expect in terms of like forms for them,
Right.
teachers, that sort of thing?
Yeah. So when we're talking about the evaluation process, we'll have patients or parents come in, and usually part of it is the history. So figuring out, their birth history, because preterm birth and other factors along the first year of life can predispose you to ADHD. So kind of trying to put those questions to, okay, is this a part of their picture that has led them down their path? Family history. Huge. A lot of children with ADHD have parents with ADHD, or just nearby relatives with ADHD, and that plays a big role. And then we look at things like their sleep, their diet, what behaviors that we're seeing. And once we've established, okay, this makes enough sense that I think we should get some objective data, then what the typical approach is to get data from parents and kind of more of a objective set of here's what we're seeing, here's what we're not seeing on a regular basis. And then
Mhm.
also from another source like a teacher or somebody else that can speak outside of the parents on what they're seeing on a regular basis with the child. That is kind of the traditional approach when it comes to, okay, we're going to make this diagnosis based on the DSM criteria. We have to have these certain number, the score for home, the score for school, and then that's kind of how that plays out. So usually, you make your appointment with your pediatrician, you'll talk things through, you'll get the forms, the teacher will fill them out, the parent will fill them out, and then we'll meet again to talk through what we've found and what the approach will be, starting off of here's where we're going to focus first, or here's where we need some more information, maybe pulling in a therapist or psychologist to get additional information if we're not exactly sure, if it's not completely cut and dry what's
Mhm.
going on. And so I
Mhm.
think the process usually for most families, it really depends on availability of your of your pediatrician or whomever you're starting the process with. But we try and do it within a couple of weeks of first visit, forms filled out and back. And the nice thing nowadays is like it's all electronic. So we just send it to parents,
Yeah.
send it to teachers. A lot of parents a lot of parents that have ADHD will fill out the forms in the parking lot before their next visit, which is
Yeah.
fine. I totally get that because we see them come through like, oh, yep, their appointment is in 5 minutes, and there's their form. The teachers fill them out, then we talk through and come up with a game plan from there.
Yeah. I just want to share again my personal experience. So we went the psychiatrist route, and just kind of a funny antidote reflecting back. So when we went in for that first evaluation, it was my daughter and me, and we had already filled out a lot of forms and had either we had done teacher forms already or did that soon after. But I was so protective of her self-esteem, and
Oh,
I
for
had
sure.
ADHD myself, and remember some of that internal dialogue that I had as a small person. I wasn't
Mm-hmm.
diagnosed till undergrad. And so I brought some wireless headphones, and I told our provider, I want you to evaluate her, talk with her,
Mm-hmm.
ask her every question. And then when we are going to be talking as two adults, I'm going to put a podcast in for her. She's going to listen to her
Yeah.
little story. And I remember that provider at first, just meeting me was like, well, I have to talk to her. I have to evaluate her. And I was like, please do. But I know that some of the things that I'm reporting to you because we had already done all of the sticker charts at school with the
Sure.
frowny faces, and the messaging is already like,
Mm-hmm.
you're bad, something's wrong with you, you're not doing enough, you're not good. And so I was going to do anything that I could. So we did that, and I swear that provider was like, who is this mom? We now like adore each other, and she's so good with my daughter. But I just want to share that story, and as an option for parents as well, if you were looking.
I think that's so smart because you unfortunately do never know what they're going to say or how they're going to phrase it. I mean, this comes up a lot like in the weight space too, of like how physicians and other clinicians talk about weight in front of the child. Like that's something that is important to get right and not to misspeak. And so I think it's really wise to say, hey, I want to talk about this with the child, but I'd also like have some time to talk without them in the room so that we
Mhm.
can uncover a few of these things that we're seeing on a regular basis without adding to their shame or that they're a bad kid or they always make the wrong choices or those
Yeah.
sorts of things. In our office, we kind of just have a room that we have a little table and coloring things. We have
Mhm.
a fish tank. We have books. We just send them out to the waiting area or to a little room where they can color or play with toys
Yeah.
while we're talking with the parents so that we're able to have those conversations. Because I don't want
Mhm.
I don't want the parents to feel like they have to hold back. And I don't
Right.
want the parents to feel like I'm just going to, say something that is going to upset the child or really hurt their self-image of themselves and put the
Mhm.
parent in that awkward position. Um, and then it gives me the chance when we do talk with the child to have it be, okay, here's what ADHD looks like. Here's how your brain is wired differently. You
Yeah.
know how when some kids do this, it's really hard to do this. That's part of your brain wiring. And you can have those really good discussions where you loop the child in rather than
Yes.
making them feel like, well, here's all the bad, my mom or dad just told me this huge list of all the bad things. And everyone's just talking about all the bad choices that I make.
Yeah. And yes, I think that is important to note that I'm a firm believer once the diagnosis is established, that we share that with our
Totally.
child. That was very
Hmm.
important to me, at least. We told our daughter, we communicated this in a positive, strength based way. I think the way that we talk about ADHD is going to influence the way that our child views it and essentially views themselves.
For sure.
Do you have any tips for parents on that or sharing with their child?
I mean, I think that it's really important to talk about all the strengths and really focus in on the strengths. Yes, we all have the things that we struggle with, whether you
Yeah,
have ADHD or not,
yeah,
and being able to be vulnerable and honest about those, about here's my strengths and here's my weaknesses, is really helpful to model as a parent. But I think when it comes to talking with the child, it's really here's what you're really good at. You're so creative and you have such a great sense of humor, and
mhm,
you really love focusing on these specific things. And
mhm,
these things that are kind of boring are more of a challenge for you. So let's figure out how to use our brain wiring to, you know, do what we need to do and enjoy life and enjoy friendships and enjoy school and enjoy time as a family and really focusing on the positive aspects. is
Mhm.
so important, especially when it's first coming to light that
Yes.
my brain is wired a little bit differently than my friends' brains are.
Mhm. Yes. And we use that language all the time. Our brains are wired differently.
Mhm.
Just to normalize her experience. It's not, bad versus good. It's just
Right.
different. We're all
Right.
different. So let's move past kind of the evaluation assessment process. Say a family is, given the diagnosis of ADHD with their child. Let's talk about treatment options. And although I know it's not the first line of use, I want to go straight for the medication
Sure.
chat just because this is something I know that I weighed the pros and cons with my husband for a long time. And I hear so much from other parents about this fear and stigma
Mm,
around ADHD medications specifically. In fact, I hear almost almost the majority of parents that I hear from will say something to the extent of, we will do medication as a last resort.
totally.
And I understand that sentiment, but what are some of the common fears that you hear as you're chatting with parents about medication?
I think medications in general are thought of as cheating. And I
Mm,
think that parents feel like I should be able, or my child should be able to figure this out on their own
yeah, I
without
have so
needing
much compassion for
medications.
those parents. Yeah.
And I think that it's unfair for both the child and the parent to feel that way. But it's something that we work through together. And I always use the analogy of asthma. Say
Okay.
I am a asthmatic who's really triggered by cold temperatures, like cold air triggers my asthma. And I'm also an Olympic skier. If I go up on the mountain and I don't have my asthma medication on board, I'm going to have trouble breathing and I'm not going to be able to perform at my best. Like I'm just going to be huffing and puffing and I'm not even going to be able to make it down the mountain.
Mm,
Nobody's going to say, hey, just breathe harder. They're going to say, oh, you have asthma. Did you forget your asthma medication? Let's get you your asthma medication so that you can breathe better. And then once we do that, then I can perform like an Olympic skier that I've
mhm,
trained for. It doesn't give me an edge. It's not making me, better going down the mountain. It's just letting my lungs not be so inflamed, so triggered that I'm able to function at my best. And I think when I explain it that way to families, that it often, okay, that actually kind of makes sense, that like it's not letting them cheat the system. It's not,
mhm.
I think medications sometimes get a bad rap because people remember friends in college that use them to like study and to
Oh,
like zone in. That's not what we're
mhm,
doing here. We're
mhm,
helping them to be able to focus so that they can talk to their friend, they can enjoy a basketball game, they can learn and talk and communicate and regulate themselves. And
mhm.
so I think that is a big fear of parents that's
Yeah,
misplaced, that the
yeah.
medications are going to allow them an edge that they don't deserve, or that it's like just kind of
Mhm,
the easy way out. And I
mhm.
don't find that to be the case, that medications are the easy way out by any means. But it
Right.
does, medications often give the child enough bandwidth to figure out how to regulate, to figure out
Yeah.
how to put those executive functioning skills into place.
Mhm.
Um, and so that's how I kind of approach the topic of medications. But I do know and hear from a lot of families that, like you said, this is my last resort is medications.
Mhm. Another common fear that I hear is parents worrying that starting ADHD medication is going to increase the risk of addiction
Mm.
later in life. And this is something I talk with people about all the time. What is the research or what is your clinical experience surrounding that
Yeah,
line?
actually, starting ADHD medicine at an appropriate age when they are, diagnosed and having those levels of interference that we say, okay, we need to start a medication, is actually protective against addiction later in life. It doesn't lead them to be addicted to ADHD medications or have other addictions. What it does is it teaches them how their brain works, and it helps them to make good choices and have the ability to put a pause before I do something that I was thinking of doing, but I instead took a pause and took a
Yeah.
beat and realized that wasn't the right decision. And so what we see in untreated ADHD is higher rates of substance abuse, more dangerous behaviors, more risky choices, because we don't have those breaks that our brain might be missing. That medication actually helps us to put those breaks into place and say, this isn't the best for me, or maybe I shouldn't say that, or maybe I shouldn't climb onto that, tall tower. Those are
Mhm.
things where without ADHD medicine, we run the risk of them making that choice because their brain doesn't have those breaks. And so when parents tell me that they're worried that their child is going to be addicted, I tell them, actually, if anything, it's going to protect your child from substance abuse issues down the road.
Yeah. And parents are always so surprised to hear that. And that is something that I'm sharing. A lot of times I'm on the other end of doing therapy with the mom
Yeah.
who's going through the process with their child. And so we're navigating that. But I understand that fear. So as we know, medication is one tool, right, for families and exploring all types of support. So let's chat a little bit about therapy. So,
hmm
if a family wants to explore therapy, are there any like types or modalities of therapy that
Mm.
you encourage, such as play therapy, neurofeedback, anything like that?
I think it's best to look at like what the child is actually facing when it comes to ADHD, and then kind of use that as the guide for where we should put our therapy time to best spend it. We know that ADHD, like we said earlier, is the hyperactivity and the inattention. But two of the other big domains that often don't get discussed that are huge when it comes to both their current and life trajectory when it comes to their mental health are emotional regulation and executive functioning. Emotional regulation, dealing with difficult moments, challenging moments, and figuring out how to cope with that, or difficult
Yeah.
feelings, or rejection, those sorts of
Mhm.
things, self confidence. And then executive functioning is the organizing and the planning and the executing the tasks that we need to do. And so trying
Yeah.
to get a better handle on where the child is really having difficulties guides, in my view, where to focus when it comes to therapy. A lot of it is recognizing the times that it's difficult for us to maintain attention, and what sort of executive functioning strategies can we put in place. So that would be like a good therapy around executive functioning, which might
Mhm.
look like play therapy, which might look like sitting in someone's office and talking through those things, or doing some executive function coaching. There's all sorts of different options there. But then on the flip side, it's dealing with rejection. It's dealing with transitions and other
Yeah.
difficult moments. And oftentimes that is really helpful with like a play therapist or a traditional therapist in a office setting as well, where there's lots of ways that we can help to build those skills in when we're
Mhm.
approaching the child with those specific issues.
Mhm. In terms of like, alternative or complementary and alternative treatments like OT, PT,
hmm
chiropractic care,
hmm
are those on the front line of things that you are encouraging parents to explore?
Specifically, occupational therapy, especially that's one where I find a lot of children will benefit, especially if they have a lot of issues with on the sensory side of things, which can definitely be
Mm,
the case in ADHD. That we have
yeah.
different sensory challenges: proprioception, interoception,
Mhm.
vestibular. If those are not being
Talking my
addressed,
talk.
then oftentimes what happens is it's really hard to make progress in regulation and focus when our body feels out of sync. And so OT is a big one from an emotional regulation standpoint for me. I haven't seen a lot of research around chiropractic that there are strategies that actually help with the brain wiring, and so that's not one that I typically turn to. And then physical therapy, not so much either. I feel like physical therapy by and large is more the musculoskeletal system and making those things line up. But I do find that occupational therapy of those that you mentioned is definitely the one that I would turn to most frequently.
And for my own child, so we haven't explored OT, but we have learned just through knowing our child and supporting her, she has a huge need for sensory input, right?
Totally.
And so for us, that looked like she is always crashing into things. When
hmm
she's walking in a room, she's touching it all. She's touching me. She's stepping on me.
hmm
She's a, hard player. She wakes up full throttle and she doesn't have a slow down speed until bedtime. And she likes a lot of like rough play and rough housing. And so we've learned ways just to put that into our daily life.
For
And
sure.
so like, especially with that emotional regulation piece, if she's dysregulated, we go we take a time in together and we're doing what we call karate chops. I throw a
hmm
pillow at her, she karate chops it. I throw it to her. We're doing that. And we also just do a lot of physical activity to kind
hmm
of meet that sensory need for her. Basketball is one. She's a real little hustler. She gets right in there. She loves it. But finding those ways, if OT isn't in your, whether it's like your budget or your
Right.
time or
Right.
it's on the to-do list, still
Hmm.
finding ways to meet some of those sensory needs can be really beneficial. I know from my own personal experience.
Yeah, I think those are great ways to help fill that bucket. They burn some of that energy and cortisol too, so that after a big day, I think that a lot of parents will find that if they take the time, even just 5 or 10 minutes of
Yeah.
specific work, whether it's heavy work, whether it's movement, whether it's balancing, those sorts of things, that
Mhm.
that can make a big difference for your evening, just in and of
Yeah.
itself, of just adding that in there and saying, okay, I know it's going to take 10 minutes, but it's actually going to give us hours of an improved time with our child and more connection without as much correction, because we took that time. And so I think figuring those things out, working with an occupational therapist, seeing what's working and kind of
Yeah.
experimenting with your child to see what actually helps them, is a huge way to help them outside of just telling them you need to sit still, you need to do this, you need
Yeah.
to do your homework, all those sorts of things, which don't usually work.
If only.
Yeah.
So let's chat like nutrition
Yeah.
and just lifestyle. So
Right.
parents hear a lot of different things, right? About like cutting sugar,
Hmm.
eliminating dyes, supplements, high protein. From your perspective, what are some things that you suggest as a pediatrician?
Right. So nutrition plays a huge role. And I think nutrition in the past has kind of gotten underrated as just like, we'll just give them the medicines and then let them eat whatever they want.
Okay.
Um, but I think that's kind of where I typically start, is let's make sure that nutrition is on the table as something that's being helpful. And then we can move on from there and find other things. When I think about nutrition, there's lots of different things that you can do, but the most important one in my book is a protein rich breakfast.
Yes,
Protein
and I love
helps
that you talk
to,
about this. Sorry, share
no,
with
you're
us
good.
'cause I'm excited
Yeah,
to learn.
so protein helps to regulate the blood sugar. And so you want a good like 20 grams plus of protein first thing in the morning, because it will help with their blood sugar. Because if your blood sugar is all over the place, then your body is going to be not able to help you to focus and attend to what you need to attend to. You're going to have blood sugar spikes, your blood sugar will go way up, and you'll feel really hyperactive and
Yeah.
kind of buzzing, and your insulin will drive down your blood sugar, and you'll be inattentive around 10:30, because your blood sugar will be so low. Protein helps to stabilize that. So if they do have something that's carb rich for breakfast, fine, but make sure that they also have protein as well, because that helps to stabilize the blood sugar. Dopamine, which is like the main neurotransmitter that we think about with ADHD, is a neurotransmitter that comes from amino acids, which come from protein. So protein gives your brain the fuel it needs to make dopamine, so that your child can, be focused and regulated and not hyperactive, and all those different things too. So protein is number one.
Yeah.
Outside
Can
of
I
that,
pause you
yeah,
right
yeah,
before?
please.
Because I want to share this with people. I watched one of your videos where you were like, we have three, I think, three simple breakfast options for our family. I mean, you have six kids, and so I imagine mornings are busy. Can you share with us kind of what that looks like for you guys and how you have made it simple?
Yeah, we've tried to make it simple because there are so many different options. Our let's see, 12-year-old makes scrambled eggs for the whole family. So every morning he turns on the stove, he cracks the eggs, he makes scrambled eggs, which is a great source of protein, and it's also like a confidence builder for him. And it takes
Yeah.
it off my plate of having to make those. He's a pro at that. So we do scrambled eggs typically. We typically do peanut butter toast. Peanut butter is another, or nut butters in general, are a great source of protein, and peanut butter toast. Who doesn't like that? We
Hmm.
do overnight oats. Oats
Yeah.
have protein and a bunch of other vitamins and minerals that are supportive too. So those are kind of our main three
Yeah.
options in the morning when it comes to what our kids eat, so that we can keep it relatively simple, but make it tasty, easy to make, and get them protein to start their day.
Yes, I loved that when I heard that because we prioritize protein in the morning,
Hmm.
especially our daughter is on a stimulant. And so before she eats breakfast, we do our high protein breakfast, or I'm sorry, before she takes the med, we do our high protein breakfast. And I was trying to like every morning come up with some new creative
Oh gosh.
beast, and I don't know why I do these things to myself. And sometimes it's just you hear the simple advice and you're like, duh, why didn't I think of that? And so when I heard you say that and just like, yes, because they don't really get sick of it. They're pretty happy. My kids are, so just keeping it simple of, three or so things that I know that they like and that
Right.
they will eat and rotate it. I
Yeah.
love that.
The one that I will say is kids that like cereals a lot. If you need to add some protein and can't get them off the cereal straight away, is put a big dollop of peanut butter on the side of their bowl and have them while they're eating their cereal, just getting a little bit of, I mean, it is so good that I tend to do that myself now, like with some Raisin Bran Crunch or something like that. Add peanut butter and you'll get more protein and it'll taste great. And your kids will love that. And that's a great way to just it's not sneaking protein in there, but it is adding some protein to the food that they're already eating.
Yeah, I love it. And so we were also kind of just talking about some of these other,
Yeah,
lifestyle things, like eliminating dyes is
sure.
one. Thoughts on that as it relates
I
to
think
ADHD?
that for some kids, and usually parents know if their kid is sensitive to dyes. Not all kids are sensitive to dyes, but some are. And we don't necessarily know how to predict who's going to be more sensitive. But if you find that your child is more dysregulated, they're more all over the place after they have dyes, then eliminate dyes by and large. I
Hmm.
don't think that you have to, you're at school pickup and they're, having a birthday party and they're all getting cupcakes. You don't have to go knock the cupcake out of your daughter's hand or something along those lines and put an apple in there. I don't think you have to get that extreme, but I think the things that we choose to stock in our home are what our children mostly eat. And so if we don't stock things with dyes, then the occasional Skittles at grandma's house or something like that isn't the biggest deal that we need to really focus our energy and attention on. But if we can eliminate most dyes, if we can eliminate most ultra processed foods, then
Yeah.
typically kids with ADHD will do better from a nutritional standpoint.
Yes. So for us, we say we are reducing dyes
Yeah.
because it's not realistic for us to eliminate dyes for our
Right.
family. Every
Right.
family is different. But I'm not with her at the birthday party or all the time
Exactly.
at school. And so our daughter knows that, like when we're choosing food at the grocery store.
Hmm.
But one day she came home and told me, Mom, at school, our teacher gave us a mini bag of Skittles. And I told her, my mom doesn't like red dye.
Hmm.
And I said, oh, you did? Then what did you do? She goes, well, I ate it. I'm
Of
like,
course.
"Hey," and I don't care that she ate it because we're not to that level of strictness, but I love that she's like, "Well, I told the teacher that I still ate it." I'm like, "Well, you are 7, so that makes sense."
Yeah, I mean, I feel better when I don't eat a lot of donuts, but if there's a donut available, I might eat it.
Yeah, exactly. What about like supplements?
Hmm.
So, I feel like just in general, our society is talking a lot about supplements, and a lot of that is great. Like, I'm a huge proponent of vitamin D for us
Sure.
Midwesterners.
Oh, for sure.
And, we hear a lot about like fish oil,
Hmm.
magnesium, like when it comes to especially, children 12 and younger,
Hmm.
what is needed and what might be beneficial for ADHD.
Right. It can be tricky, and everybody has an affiliate link on their
Ah,
Instagram and TikTok to get you to buy their vitamin that's going to totally change your child. And most people
life
will
change.
get one or two of those, and then they'll realize like they're just on the shelf because it didn't make that big of a difference. There are definitely some nutrients, vitamins, and minerals that have been shown to be helpful in children with
Okay.
ADHD. I like testing when possible before just saying every
Mm,
kid should be on this, because
okay.
what happens is if we say, well, take this and this and this and this, um, they end up on the shelf and they get forgotten and they don't get taken for months at a time, which is super guilty of that in our own family. Just even thinking about to babies and vitamin D drops and how
Yeah.
most people have all the intentions of giving it every day. And then it's like months go by without getting that
Yeah.
to your child. And so the ones that we will typically test for and then treat, if their numbers are low, is iron. Iron is
Mm,
really important when it comes to sleep. So children with low ferritin level, the ferritin is what we measure for iron. Low ferritin is associated with increased restless leg, which makes it hard to sleep well at night. So they get poorer sleep. Even if they are asleep, they're rolling around and their sheets are all over
okay.
the place.
That might be why
Um,
my daughter's a ninja sleeper.
yes,
Lots of
that's what we
ferritin.
describe it as a ninja sleeper. Iron is also required for the amino acid to dopamine synthesis. And so, if
Mm,
our brain doesn't have enough iron available, we can't make all the dopamine that we need. And so, iron is a big one for me. And just testing that. And then, if it's low, like if the ferritin is low, then treating that, we do see, a 5 to 15% improvement in overall symptoms. unlike what Instagram and TikTok will tell you, nothing is 100% and it doesn't make the complete difference, but 5 to 15% improvement in your child's symptoms is nothing to, just brush off either.
Yeah.
Iron is one. Vitamin D is definitely another, especially in the Midwest here. And so that's something that we'll check. And if it's low, we'll definitely treat that. Zinc and copper are two that are a little more nuanced, but I will check those because a lot of children with ADHD have low zinc levels and high
Mm,
copper levels, and that
okay.
interferes with some of the neurotransmitter synthesis and function. And those are the main tests that I would do.
Okay.
Magnesium is another one where we know that is their children that are on stimulants, especially burn through magnesium a lot faster than their peers, and that children with ADHD typically have inadequate magnesium at a baseline.
Okay.
And so I will typically not test that because when you test it, it's almost always normal in the blood. The blood
Mhm.
maintains a normal level, but we will usually give them some magnesium. And then omega 3s, like a omega 3, like fish oil, something along those lines, are shown to help too. Not something that you can really test for, but something that helps. So basically, that sounds like a lot, but
Yeah.
usually if their iron is normal, if their copper and zinc are okay, and their vitamin D is okay, then there really aren't any things other than maybe the omega 3s that we're going to add on a regular basis. But I do find it worthwhile and inexpensive to just test for those things. And if we
Okay.
do test and we say, oh yeah, her child's ferritin is low, then parents are going to be motivated to actually remember to take the iron on a regular basis rather than just, yeah, they might need some more iron. Here's some iron supplements. If they know that their ferritin is 12 and we want it to be 45, they're going to give their child the iron on a regular basis, and then we'll recheck it and get it to a good place and see what the results
Okay.
are for the child.
Okay. And those are tests that a parent could go to their pediatrician and request?
Yep, definitely.
Really? Okay, great. So I want to chat a little bit about, or are there any other lifestyle things that you like to include as you're supporting kids and families?
I mean, I think sleep is a huge one that's underrated, and that sleep is a huge thing that we focus on in our practice is making sure that we're getting adequate sleep and sound sleep when we're sleeping at night. So, kind of talking through what their sleep looks like and giving strategies to improve their sleep, whether it's an earlier bedtime, whether it's a longer wind down period, whether it's eliminating screens earlier. Those are things that we talk through to make sure that we're getting good sleep, and also that we don't have some sort of thing like obstructive sleep apnea or something along those
Mhm,
lines that's interfering with getting restorative sleep.
mhm,
And then other things would be like limiting screen time. So not too little screen time and not too much screen time. And
mhm.
that varies by child and season and what they're getting at school and all those sorts of things. But I like to make sure that we're getting a good balance of screen time and real life. And if there's too much screen time, then it will often make our ADHD symptoms worse. They're
Mhm.
controlled while they're on their screens, but when they come off of them, it's much more challenging, or getting them off of the screens is much more challenging. And then outside play is another kind of
Yeah.
lifestyle sort of change that I find that helps kids and families to enjoy time together more and to work through some of those big feelings and big energy buildup, especially over the course of the day at school.
Yeah, absolutely. So I want to chat a little bit about school. So school is often where a lot of ADHD challenges become more visible. Focusing in class, maybe like peer social interactions, and that constant feedback from teachers
Right.
is really hard on us parents. What advice do you have for parents to work together with the school or advocate for their child in the school setting?
I think that word advocate is so important. And I think it comes down to making sure that your child doesn't get one labeled as the bad kid, because
Yeah.
that's common. And so we need to really focus on how can we set our child up for success in the classroom so that we're not getting constantly corrected and we're not getting constantly punished.
Mhm.
Um, and then two is that they're not getting forgotten because they're inattentive. And
Mhm.
so I think really making sure that when we talk with our teachers or the school staff, that we say, here's what I think would be helpful: sitting at the front of the class, extra time for tests, being able to fidget, being able to stand up, being able to move our body, move our limbs, take breaks, refill those dopamine reserves makes a huge difference for kids. And I think most teachers understand and want those kids that are
Mhm.
regulated and attentive. And if you
Yeah.
can help them say, hey, here's what I found at home, really helps for us to get our homework done. That makes a huge difference for working together collaboratively with the teacher, with the school staff, to optimize for success and minimize the number of corrections.
Yeah, absolutely. And from the parent standpoint, I feel like building that relationship with the school is so important,
Huge.
because there's oftentimes ideas that I have based on my child's report of school and then my own ideas about what her day looks like. And then when I talk with the teacher, it's, oh, okay, I feel a lot better about that now that
Yep.
I talked with you. And
Totally.
this story that I created in my head is so different.
Sometimes the
Um,
story that our kids tell us is so different.
they are not always accurate reporters,
Yes.
for
Might be
sure.
accurate
Not
in their mind, but not in the reality of the situation.
Yes. Yes, exactly. And so just building that relationship. And even like, for example, this year, my daughter's in second grade and they don't have lunch until like, I think, noon, which I know is a normal time for a lot of people,
Sure.
but I was used to her having early. And then that's right after that is her first recess. So
Yep.
my brain, I'm like, my ADHD kid is not getting, fresh air or body movement until after lunch. Like, how
Hmm.
can we work in some breaks?
Right.
So I like talked with the teacher and found out she is doing a lovely job of fitting in those breaks because
Hmm.
just like you said, she wants well-regulated kids. She
Totally.
wants kids and she understands child development and that they need movement breaks. And so those are already built into her classroom schedule. I just didn't know. And
Yeah.
so I created this story of like, how is this school not,
Right.
getting any
They're
movement in
sitting
for
there
these
for 4 hours straight, like not even moving. Yeah. Yep.
yeah, and so, just having those conversations and building that relationship is really gonna help in supporting your kids in the academic environment.
And I think to the extent that you're able to collaborating and saying, hey, here's what we're doing and here's what's working. What are you finding that's most helpful for our child? And are there things that we could be doing at home to help that would support you during the day? Whether it's helping teach them some more executive functioning skills or how to regulate when they're getting frustrated or upset. Like these are things that
Yeah.
we can work on too that are going to help the child and also going to help the classroom.
Mhm. And then when do you feel like parents should be, like, advocating or looking into formal support such as
Hmm.
504, IEP, and are you as a pediatrician involved in that process?
Yeah, I mean, at least our office, we do write a lot of letters in support, or like, here's the things that we want to make sure are included in their 504 plan or their IEP or those sorts of things, so that those are coming from with some authority of, hey, let me support the parent and support the child by making sure that these things are a part of that. And I think that most schools, at least in this area of the country, do a good job of noticing, okay, we've tried kind of the first level of measures. Now we
Yeah.
need to escalate things, and it's something that usually evolves over the first couple of months or years of diagnosis of here's
Mhm.
where we're still seeing the gaps, here's where we could still use some extra help.
Yeah. So I did get a few parent questions,
Ooh.
and so I want some of them we've already kind of answered, I think. But in terms of school, so I got a question from a parent about their kid is in like after school
Mm.
childcare, and it said, "How can I help after school daycare learn to respond to a child with ADHD?" Any guidance
Mm. I think similar to what we just talked about when it comes to the teachers is coming up with a collaborative plan together. And oftentimes the way, instead of like do this for my child, at least for me, it seems like most are more game if it's like, hey, let's figure this out together. Or
there?
hey, I'm
Hmm.
noticing this. Do you see this as a problem? What I found is helpful is making sure that they get a protein rich snack after school and that they
Okay.
get to be in charge. So do you have any opportunities where they could be the leader and exert some
Mm-hmm.
control? Figuring things out like that is probably the most collaborative way to
I
really
love it.
help them to get to the point of, okay, after school is going okay, the after school program kind of understands my child amongst all the children, and they know that they need to move their body and that they've been sitting for a lot of the day, and
Mhm.
that hopefully we can work together to figure out how to make it more pleasant for everyone.
Yeah. Okay, for the parents that are listening, I know that you offer a lot of education and workshops about an array of topics. Can you share a little bit about the resources that you provide and where parents can find out more about you?
So there's three big things that I really like. One is I like writing and creating content online about ADHD, and so I do Instagram, but I also have a Substack that I really try and put a lot of energy into, a little bit longer form. In Instagram, you can only say, a couple 7 or so seconds of things before people swipe
Yeah.
forward. But on Substack, so it's dearparents.substack.com is where I
Okay.
do a lot of teaching about ADHD and other parenting topics. One thing in particular that I really like helping families to uncover about their child is what their child's profile looks like when it comes to hyperactivity, inattention, but also executive functioning and emotional regulation. And so I created a tool called the ADHD Compass
Okay.
that lets you see with your child where they're at when it comes to those 4 different domains. And it also gives some advice when it comes to dietary changes or
Oh,
parenting
great.
practices or those sorts of things, because it can be really overwhelming for parents to see all the different domains and not really know where to start. And so that's a tool. I
Yeah.
can I can give you the link to that, and
Okay.
it's on my Substack too. But that's a
Great.
good resource for parents to kind of get a visual of where their child's at, put some
Yeah. And maybe like,
practices
where
into
do I
place.
start?
Yeah,
Yeah.
put some practices into place, and then see how it improves over time and like where we should focus next.
Love it.
And then my clinic in Lincoln. So we actually do virtual and in-person appointments for ADHD, anxiety, other parenting or behavioral concerns. And so we see a lot of families in Lincoln, but we also see a lot of families in Omaha and Iowa and around the area that want to get help with their child, both if they're diagnosed or they're really not sure or they're having other behavioral challenges. Coming alongside them and kind of helping them to figure out how to move forward with their child and help them to thrive.
Love it. And as a pediatrician, I mean, you are putting out education about a lot of topics. So I want to make sure people know that too. I mean, I'm seeing everything from, newborn babies, and I just think of all the questions that we have as new parents of sleep and are they eating enough? And so I heard you say your Substack, your Instagram, and then you have a podcast as well.
I do. I forgot
Yeah,
about that. Yes,
hear
it's
about
called
that.
Dear Parents. Sorry, I forgot about my podcast here. It's a Dear Parents podcast. So that's on my Substack too. But Dear Parents podcast on whatever podcast platform you're on.
And what are some of the topics that you cover?
Yeah, so I do talk a lot about a lot of different things. I try and mix it up so every episode has an interview. It has some sciencey stuff on the science of pediatrics and parenting, and then some things about parenting itself. I'm a big authoritative parenting fan, not authoritarian, authoritative, and I like teaching families about how to implement those practices into their day to day lives. So that's kind of the bulk of my podcast is really helping parents at the different ages and stages that they're at.
I love it. So, as we kind of wrap up today and in this conversation about ADHD, if a parent is listening, and what is kind of one piece of guidance or one thing that you want them to remember as they are learning how to support their ADHD child?
I think it's overwhelming for parents because there's so many different areas where you could spend your energy and focus. And I would say pick one specific thing to work on this week. It might be getting them more protein in their breakfast. It might be creating a list so that in the morning they know what to do rather than you having to correct them and remind them all the time. It might be after school before jumping into homework, taking 5 minutes to run, to jump, to play, to do something along those lines. Introduce one new strategy and then see how it goes and see how your child changes and reacts to that, and stack a bunch of those over the course of weeks and months and years together to figure out how to help your child thrive. But it can feel really overwhelming to do all the things at once. So don't try and do all
Yes.
the things at once. Pick one thing for this week that's going to make it just 3 to 5% better, and then see those stack on top of each other over the
Yeah.
coming weeks and months as you figure things out.
I think that's great advice. Well, Phil, thank you so much just for taking the
Absolutely.
time, for joining us and sharing your insights today. I really appreciate it. We'll be sure to put in the show notes where folks can reach you. But thank you so much for the work that you do and for joining us today.
You are so welcome. Thanks for shining light on all this. It's been great to chat.
Yeah. So for those that are listening, if this episode resonated with you, please share with another mom who might need it. My goal with Omaha Mom Talks is for parents to feel more supported and more heard and seen and understood, because parenting is not easy. And if you have future topics that you want us to chat about, send me a DM on Facebook or Instagram and we will bring that to life. And until then, please take care of yourselves. Bye.